GP Champs is a drop-in service provided by YPAS so that young people can speak to a medical professional in an environment where they're comfortable and feel safe.
We do health sessions on, say, drugs, alcohol, mental health, sex education, stuff like that.
I attended for the social group discussions as I've learned about issues that I never knew were health issues amongst young people.
GP Champs benefits young people from the social aspect, so it helps develop communication skills, and also they have sessions which are about health, so it's engaging with other young people.
GP Champs is different because there's more people to socialise in your own doctors. You haven't got no one to socialise with really, just your doctor, maybe the nurse, but your friends aren't there for your support.
I personally think that most young people are reluctant to go to the doctors because it's uncomfortable, it's not a nice experience.
It's harder for younger people to go and see their doctor or their ordinary GP, and this gives a chance to give them a more comfortable environment other than a GP service.
We feel comfortable coming to YPAS because it's a young person's space, and when we come to see the doctor, she's like really lovely, but if you go to your own doctor, you know what I mean, you can't always speak about what you want.
So I've been coming to see Diane in secret from my doctors because I don't want them having put certain things on the system, because I'm unsure about certain things with my doctors.
I don't have to explain to my mum and dad why I've been to the doctors because they won't know that I've been to the doctors. And it's just a nice feeling to be able to do that, and it's really comforting, and it's not going to the doctors even though you are.
YPAS started doing GP Champs here, and I've been to see the doctor here quite a few times, and I felt really comfortable around her, and I referred myself to a GP.
Dr. Exley, who's the GP here, is friendly and approachable, so I think that's a very big positive, and it makes coming here less of a worry.
I've been battling for years to get cervical screening from my doctor, but with me being only 23, he wouldn't do it. And Diane here, she done an examination and told me everything's fine, so I don't have to worry because my mum had cancer, so I worried about that.
GP Champs kind of gives me more comfort. I'm happier knowing that I'm coming here than going to my doctors.
It's really opened my eyes, and I'm much more sensitive now to different people's needs and problems and issues.
It just provides me with like a security blanket, because I know that once I've seen the doctor, I'm coming out to a friendly face who can talk to me.
It gives me confidence coming here every week, and I really do enjoy doing the health sessions.
If GP Champs wasn't here, there would be a lack of support for me, but also for other young people.
GP Champs has been a very positive experience for me. It's definitely made me a better person coming to YPAS and GP Champs.
Well, basically, in a few words, if GP Champs weren't here or YPAS, I don't know where I'd be myself.
GP Champs is a collaboration between a voluntary youth service and a GP organisation, and there are 10 sites across the country. In Liverpool we chose to, as part of the GP Champs, to do a youth service in YPAS. Not all of the other sites have done that, so it's different from other GP surgeries. I can give them more time, I can help them in the registration process, I can help them to know what to expect from a GP. So it is a way of them accessing their own GP as well as accessing here. But the idea is for me not to see them forever. It's just to help them in the process of accessing their own GP. Young people often have things that they don't necessarily think is important to mention to a GP. They often have to get the GP to trust them before they will tell them things. So often as a GP, if you're busy and rushed, you may see a young person as a quick catch up. So I'm not saying that they won't give them time, but they may not explore all the issues that might be on the young person's mind. And I guess that's what it's taught me in my practice, is to be able to give them time and give them a chance to explore and specifically ask them questions that might be relevant to them. I would like to see the project develop into a more, I guess more of a joined up service that it involves young people and organisations for young people being all in one central part. They have done this model in other parts of the country, particularly the Well Centre in London, and that's had many more years than we have. So I do think that a lot of the organisations that have come into YPAS to do this have got a lot to offer, and all being in as a one-stop shop would be, I think,